Now let's talk about the abdominal aortic aneurysm scan. The aorta is the main blood vessel that carries oxygen-rich blood from your heart to the rest of your body. As you get older, the wall of your aorta can weaken and swell. This bulge is called an aneurysm. It is more common in the part of the aorta situated in the abdomen. You are more likely to have an aneurysm if you are male and you smoke and have high blood pressure or high cholesterol. Sometimes there may be a history of an aneurysm in a close relative. You may be unaware that you have an aneurysm, as it rarely causes symptoms until it ruptures. A ruptured aneurysm is a medical emergency as it causes severe internal bleeding and is often fatal, so early detection can be life-saving. You may be offered a scan if you are at increased risk. For example, if you're a man over 65. The ultrasound scan will involve you lying on a bed with your top clothes pulled up. Some gel will be put on your abdomen and a probe that transmits the sound waves is placed on it. Images of your aorta will appear on a screen and the width of it will be measured to check for an aneurysm. What the results might mean. You will usually be given your results right away. It is a very reassuring if your scan shows that your aorta is normal and you will not need further scans. However, if a small aneurysm is found, then you will be called back for regular repeat scans, as aneurysms usually get larger over time. If an aneurysm reaches 2 1/4 inches or 5.5 centimeters, then it is more likely that you will be considered for surgery as the risk of rupture is significant once it is larger than this. Blood pressure in the aorta can cause a weakened area of the artery wall to bulge. The bulge will continue to grow and has the potential to burst, which is often fatal. A dissecting aneurysm occurs when there is a tear in the inner wall of the artery. Blood seeps into the artery wall, causing it to swell and the wall to thin. This is a medical emergency. A technician will use a probe called a transducer to bounce sound waves off your aorta. This echo information is then used to create an image of the aorta on a computer screen. Maintain normal blood pressure. Cut out saturated far from your diet, stop smoking, and keep physically active. Thank you so much for your attention.